The Blue Circle Collective is a community of people who are passionate about improving the lives of those living with diabetes. It's a community from all different backgrounds, those living with diabetes, carers, health professionals, advocates and allies. And one of our purposes is to really raise the voice of those living with diabetes on all different levels, from local communities to national platforms. I chose to be a community advocate because I see the gaps every day in access to healthcare, in education and support, in emotional support, and even in the basic understanding of what it really means to be living with diabetes.
Being a youth advocate involves turning up to as many events as possible and engaging with the kids and the teens that come along, and especially families as well. That really helps the community, because when we start sharing our individual experiences, people connect more and can relate a lot more.
There's always been stigma around people that live with type 1 or type 2 diabetes, and I think one of the ways to improve that is that people like myself living with it, we have a responsibility, I believe, to educate others. You need people to let other people know what living with type 1 or type 2 diabetes is like, and being able to listen to other people that also live with type 1 or type 2 diabetes. Because there's a lot of people who really, really struggle. It might really impact on their life, their work, their family, and you've been through it. There's nothing better for somebody that's really struggling to come to grips with it, to do that. And I wish I had that back when I was first diagnosed, because I think it really would have helped me.
I wanted to become a youth advocate because I really benefited from the work that Diabetes Australia did for me growing up. It was so great to be around other kids and to see medical staff, medical professionals that were in attendance as well. I wanted to give back to the community I've become a part of. I'm really passionate about there being good mental health support, especially for teens and young adults with type 1. I'm very passionate about getting more support for regional and rural areas and people with type 1 living in those areas.
I'm especially passionate about early detection, avoiding preventable complications, and empowering people with diabetes and the wider community with the knowledge around what diabetes means, so that people living with diabetes don't feel limited in terms of their accessibility, in terms of their choices, identity and their future.